A major new all-island study is set to change how prostate cancer is treated, with a focus not just on survival but on quality of life. The INSPIRE trial aims to reduce the side effects of radiotherapy while maintaining strong cancer control using more precise, shorter treatment methods. To discuss this, we're joined by Angela Clayton-Lea, whose organisation is sponsoring the trial, and Martin Sweeney, who was diagnosed with prostate cancer in 2015 and has played an active role in shaping research from a patient perspective. And they both join me now. And Angela, can you talk to us a bit more maybe about the INSPIRE trial, what it is, what it hopes to achieve?
Yes, good morning, Ellen, and a very good morning to all your listeners there. Yes, so Cancer Trials Ireland, we are the organisation that is sponsoring this first all-island trial in radiotherapy for prostate cancer patients with early stage prostate cancer. And what this trial involves, as you very succinctly said there in your intro, is to use the latest, most advanced type of radiotherapy planning to produce exactly the same overall survival outcomes, but hopefully with reduced side effects. And those side effects are typically in relation to urinary side effects, because when you give very high radiotherapy doses, some of the bladder inadvertently gets some dose, so we're trying to reduce that. And also uniquely to the INSPIRE trial, we will be using a gel spacer, which is inserted into the patient of the months off before treatment starts. And what that does is it pushes the rectum away from where the prostate area is. So we can get a really, really high, very focused, high-dose radiotherapy beam into the exact area of tumour within the prostate and spare more of that surrounding tissue. And also very importantly, and this is also where INSPIRE is breaking new ground in terms of radiotherapy planning, is that the way the treatment will be designed is that we will also be able to spare some of the nerve bundles surrounding the prostate gland from that very high dose. And what that means, and is very important to patients undergoing treatment for prostate cancer, is that it should reduce what's called sexual toxicity, because when those nerves are affected through radiotherapy, and they are also very routinely affected if the patient opts for surgery, then there can be long-term impact in that regard. So, Alan, INSPIRE is an all-island. It's opening in 12 centres around the country, 10 here in Ireland and 2 in Northern Ireland. So it's a genuine collaborative approach across the whole radiotherapy planning team on the island of Ireland, and sponsored, as I said, by Cancer Trials Ireland.
I have to say, Martin, it sounds like there's lots and lots of benefits, reducing treatment sessions from 20 to 5, reducing the side effects, particularly around urinary bowel and sexual side effects. You've been directly involved in shaping research like this. From your perspective, you know, how unusual is it for patients to have that level of input, and just how transformative could this all be?
Good morning, Alan. Thank you very much, and also lovely to be here to speak about this trial, because it really is a groundbreaker for so many men who will get a diagnosis of prostate cancer and would be normally, or without this trial, be facing into quite a long regime of therapy. Many of your listeners, I'm sure, will be aware of that 5 or sometimes 7 week daily visit to the hospitals for radiotherapy, preparing the body every day, with significant resource implications on the hospital, as well as the nuisance issue for people coming and going to the hospital and so on. And now we have this revolutionary treatment, it's called a SAVOR treatment, which will produce the same and even better results from just 5 treatments rather than the 35 or 25 of the current practice. So there's huge advantages. The great thing about prostate cancer research at the moment is that it's focusing a huge amount of attention on quality of life and dealing with life after prostate cancer. If it's caught early, if prostate cancer is detected early, it is very likely that the patient will get over the prostate cancer, but there can be lifelong consequences to that, Alan, and they can be very, very difficult and challenging for men. So I advocate quite a lot for prostate cancer patients who are dealing with those issues, like Angela mentioned, urinary issues, sexual function issues, sometimes bowel problems. All of those can lead then to mental health issues, relationship difficulties. And I'd like to just mention very clearly the partner of people with prostate cancer going through treatment, that can be a very difficult time as well. So the therapies and the new treatments are focusing a lot on trying to reduce the consequences, the side effects, the after effects of prostate cancer. And this particular trial is so exciting because it's ticking all the boxes for the patients, for the hospital sites, for the exchequer indeed. And we're able to, as patients now, feel that we're part of the research process. Myself and Alan Abbott and me from the north of Ireland, we were on the patient panel. We were directly involved in discussing the trial and what was the most important aspects of it from a patient's perspective. So this is a great trial, and I'd encourage anybody who might have a possible qualification, if that's the right word for it, to talk to their consultants.
And Angela, just to finish with yourself, the trial is going to follow patients for 5 years. What kind of long-term impact are you hoping to see?
So we're hoping, as I said, to see the exact same survival benefits with this very advanced radiotherapy, but with reduced side effects, with reduced toxicity. And we will be recruiting 136 patients. It'll take approximately 2 years. As I said, it is open in all 12 centres around the whole island. So for your listeners, Alan, if anybody has been recently diagnosed with prostate cancer and they are referred to a urologist, please do request a referral to a radiation oncologist. And the study will be open in the Midwestern Radiation Oncology Centre in Limerick and also in Galway. So very accessible for patients living in Clare. And we are delighted to say that we launched Inspire just under 2 weeks ago, and we've had our first patient recruited in the Bonds in Cork. So we do think we will recruit quite quickly, and patients will be followed up very closely for 5 years after their treatment.
Well, it is a huge development, and that is for sure, and very interesting to see what further progress is made. My thanks to Angela Clayton-Lea, the CEO of Cancer Trials Ireland, and Martin Sweeney himself, who was diagnosed with prostate cancer and was involved in the design of the Inspire trial, for joining us on Thursday's Morning Focus.